Welcome, everyone, to today's episode of Carefulist, the podcast. I'm Katie Christophic, founder of The Carefulist. Today, we welcome Ethan Wechtaluk to the show, and I am very, very excited and happy that he's here because we have never had someone on the show who is currently running for Congress. And Ethan just happens to be running for the Maryland 6th District. And welcome to the show, Ethan.
Thank you for having me, Katie. I'm excited to be here.
This is fantastic. So, back in the spring, I interviewed a gentleman who was a former governor of Wisconsin, and we talked about caregiving. But I have not had someone who is actively seeking office. So, this is going to be just a really interesting conversation for the audience. So, first things first, I'd love to hear your caregiving story.
Yeah, I have a couple caregiving stories, honestly. The one that is closest to me, when I was 11, 12 years old, my dad was diagnosed with Parkinson's disease. And then, if anyone is familiar with Parkinson's disease, the journey to even get to a diagnosis takes a little bit. So there was a bit of of an emotional period of time till we got to that diagnosis of dealing with the tremor and dealing with some other symptoms. So I was still young, and there was a lot to learn early on about how I can best support my dad. Um, Fortunately for our family, he had a slow progression to the disease. Um, but even a slow progression to a disease like Parkinson's, you still experience symptoms, you still experience a lot. And, with time, it became things like, he dealt with obviously a lot of tremors, but then, muscle rigidity, freezing. He, started to develop some speech issues. And, as time progressed, his needs and what required of our family to support him became, increasingly more challenging and more complex
Mhm.
to navigate. It came to the point where mobility for him, he needed to have a cane to just get around. I mean, his balance was compromised and his gait was affected, and even sometimes just being able to stand in one place, he needed that a cane, or he really probably needed a little more than a cane. My dad was a little stubborn, just like me. But he used his cane to kind of have that assistive device. But it's, like a lot of things like that, it was also being aware of where we were at and what we were doing. Were there, appropriate accommodations in terms of, accessible? I mean, places have handicap parking, places have accessible facilities, but accessibility is not a universal. It should be universal, but it's really
Yeah,
not, despite the
right.
ADA existing. Everyone kind of does a little bit differently. So understanding, like, where we were going. And, for a while I lived in a townhouse. And so when my parents would come and visit, there were stairs. I didn't have an elevator. And
Mhm.
so helping my dad navigate that. And I remember, one visit where he came to visit, and just getting up and down the stairs was an immense struggle for him,
Yeah.
to navigate. We actually ended up at one point having to have him just sit down and kind of scoot down the stairs because it was a steep staircase even to begin with.
Yeah.
Um,
Townhouses are
yeah, notorious for
notorious.
yes. And so, it really was, dealing with that and navigating that was eye-opening. And then especially in the last, he died of a traumatic fall, which is something that a lot of people experience. And it's he fell, he broke his hip, fractured his hip, and a week later he was gone.
I'm
Um,
so
but
sorry.
part of that experience was, my parents still lived in their house that I had grown up in,
Mhm.
and um, he got up in the middle of the night, was wandering around and fell, and was that then, despite helping my mom try to set up, and making sure that the things were accessible, he was on a floor where he didn't have to navigate stairs to get to what he needed to do, but he still got up and wandered around. And, that shows that no matter what you do and how you plan, there are still challenges that you can encounter that, can cause problems. And
Yeah.
that's the most direct caregiving experience I've had. But I also dealt with grandparents, so I kind of got it on two different angles.
Mhm.
I moved out of home, and my parents would come up and visit me, and I'd go visit my parents, and I dealt with my dad. But my grandparents live in relative proximity, or lived in relative proximity to where I live in the DC metropolitan area. And they did live in a retirement community, which had a lot of services for them, but I was the closest family. And so when, a crisis arose, I was the one who got contacted to go help.
Mhm.
Um, my grandmother had it was never formally diagnosed, but that was most likely early onset Alzheimer's and beginning stages, or sorry, she had early onset dementia that was diagnosed, but it was likely Alzheimer's, and
Yeah.
that severely impacted her. My grandmother was a very small woman to begin with. I think she was probably topped out 4'10", 4'11", maybe 5 feet, and but very petite. And so, when she started to develop, when her memory really started to go, it was a struggle to get her to eat, and nutrition became issues, and because she was losing weight, she didn't have weight to lose.
Yeah.
So, that was always a challenge. Thankfully, we had a blessing there, because when her memory really started to go, she became very compliant, very agreeable, very happy-go-lucky.
Mhm.
That is not a lot of a lot. I've known people who've had whether it's parents or grandparents who dealt with Alzheimer's, where it was the exact opposite. A lot of people become
Yeah.
very temperamental. She was placid. She was agreeable. She was I loved my grandmother dearly. She was a delight. She was. I was always this nice young man who came to see her, and then maybe she would remember, but I was pushed her around in a wheelchair, and it was a delight. And so dealing with that was complicated.
Yeah.
In the story it seems to be of my life, my grandparents were in a car accident, my grandmother passed away. um, you evaluate things that happen in your life, and you try to see, not let it, you know in some ways that was a blessing, that
Mhm.
her she wasn't prolonged, and she was 88 when
Mhm.
she passed, or just shy of her 88th birthday. But it did spare us from some serious, complications and things. Like we were getting to that point where my grandfather was just not capable of caring for her.
Yeah.
Um, but then I got thrust into a situation of having a grandfather who lost his wife of 60 years, who was heartbroken, and it was an emotional toll. And to watch him over the next several years just kind of gradually wither away.
Yeah.
um, and his needs, a lot of which were early on, were mental and emotional support. But when you're in your late 80s to early 90s, mental and emotional support really manifests itself physically very quickly. So his needs became a lot more immediate and a lot more direct. He started to have a hard time, you know taking cleaning up around the house,
Mhm.
and he was missing meals, because it was like, well, he could go down to a dining facility to eat, but it was like, well, I don't really want to go down by myself. So he would skip meals, and then he wouldn't cook for himself. Then he was starting to lose weight, and it
Mhm.
it started to shift. And we kind of reached a point too where he almost kind of lost his will to fight and to
Yeah.
live. And when that happened, he kind of mentally kind of went as well. He fought for a little bit longer before he succumbed to pneumonia. Again, not atypical in many instances of someone like that.
Mhm.
And we were able to put him in a nursing home, for that last little bit. But there's a lot. I mean, I'm 38, and I've experienced three direct situations of providing care. And
Yes.
now I'm starting to have to look at it for my own mother. And
Mhm.
what does her future hold? And what do I need to care? How am I going to help take care of her as she ages? She's at risk for, dementia and Alzheimer's. And what are her needs going to be? And how do I support her, from a
Yeah.
distance? Um, And, I want to say that my experiences are atypical, but I know they're not. And that's something probably we're going to talk about today is, this has
Hmm.
been my journey. I'm not alone in being a young person to have to care for a parent with a progressive disease, or a grandparent who is, dealing with Alzheimer's, or, other, like, I'm, I'm not out of the norm. And that's
Right.
the thing, is that every person like me feels they're alone. We're not. We just don't know how to find everyone else, and that's what you
Yes.
do. I'm glad to have met you, and that we're having this conversation about that.
Yeah. Well, and thank you so much for sharing all of that. It's like one hit after another. And I have likened it because we had my mom and she had dementia. My great aunt at the same time had dementia. My grandmother lived into extreme old age. So while there were not many things wrong with her, it was like, okay,
Yeah.
well, we're taking care of two generations above. And
Mhm.
then, we all have kids, and I know you have children. And it's
Yeah.
like, okay, how many of these things can I juggle before starts dropping? And
Yes.
inevitably, it
Yeah.
does.
It does. Yeah, I mean, when my dad fell and passed away, it was Christmas time, it was the week before Christmas. My wife was 6 months pregnant with our youngest, and we had two older kids. And we were set to go visit my parents for Christmas, but then we get the call that my dad has fallen. He's in the hospital, and it was like, okay, well, we need to go down earlier. We
Hmm.
did, but our whole Christmas experience has changed, and then we're trying to navigate this with two young children who do not understand. Well, where's Grandpa? Why is he not here? What's going on? And because of the trauma my dad was experiencing, he was hallucinating and experiencing some cognitive issues. We didn't want them to see him like that. We didn't want that to be their last experience of their grandfather, but they didn't understand. And again, so I'm going to the hospital to be with my dad. This is still during COVID, so they're restricting visitors. We can't all go.
Oh my gosh.
So, you know, my wife is home, or at my parents' house with 6 months pregnant with two other kids. It was Christmas time, so they're going nuts.
Yeah.
It's your life doesn't stop for these experiences. Your life keeps going, and
Mhm.
you hope that people around you understand what's going on. Sometimes they do, sometimes they're too young to understand, and that's not what their fault. But you still have to take care of them. You still have to take care of your parent, or your aunt, or your great, like, you still have to take
Yep.
care of them, and then you have to take care of yourself and all
Right.
of that, which is the easiest thing to forget to do. Yeah.
Yeah, that is 100% the afterthought, if it's a
Yes.
thought at all, right? I mean, you're
Yes.
just trying to survive.
Yeah.
Sort of
Yeah.
like, I mean, I don't know if this has happened to you, but it's happened to me, and my kids love to laugh about it. You get knocked over by a wave at the beach,
Mhm.
and you're just getting your footing, and you start to stand up when another wave comes, you back
Yeah.
over, and it's like, ugh,
That's
and you're just
that's exactly,
stuttering.
yeah, that's exactly what it is. Exactly what it is. It's that's such a great analogy, to use it. Because, yeah, and you don't know what is coming next. You hope
Mhm.
there's nothing coming next. There may be two things or three things that how many other waves are after that one?
Right.
Um, and that's what makes this, um, a tough issue. And it's
Yes.
not something we all experience it. I mean, first off, we all get old. Or not everyone gets old. We all need care, at some point in
Mhm.
our lives, whether we get old and need care, or we need care at a young age. I've seen several posts on social media, maybe because my algorithm knew we were about to have this conversation. I kept getting several posts that popped up where people were talking about going into hospice or caring for someone in hospice.
Mhm.
Um,
Yeah.
and these people, one of them was a terminal cancer patient. They're 41 years old. And so, for some of us, it might be sooner, unfortunately, than later, where we are in this situation, whether it's us who's laying in the bed,
Hmm.
or a loved one who's laying or our spouse, or God forbid, a child who's doing that. We
Yeah.
all encounter this. That's what they say. Death is the great equalizer. You know,
Right. Yes.
um, and it's a shame. When I started my campaign, I just assumed that this topic would be there, that someone was talking about it, and no, no one is.
Yeah.
I mean, no one is. It's it's astounding to me how it's so pervasive. It affects us all far more than a lot of things that grab the headlines, but it's not being discussed, and it's not being addressed, or um like no one seems to have a real solution to fix some of these things.
Mhm.
And that's concerning. That's very concerning.
Absolutely. Not to throw tons of statistics out into the ether, but 62 million unpaid caregivers in the United States.
Yeah.
And we have 10,000 people turning 65 every day between now and 2030. And those unpaid caregivers, that they just released new data. I think it was AARP who released it. They account for $1 trillion in healthcare. We'll call it savings,
Yeah.
because of that unpaid care,
Yeah.
which, is all well and good until these people lose their jobs.
Yeah. It, you have to ask the question, who's getting the savings on that? Because
Right.
it's not people like us. We're
Mm-mm.
paying, and yeah, it's a weird way to structurally for someone to say it, because it makes it seem like, well, the insurance companies or the government is off the hook, but they're not. I mean, it always
Mhm.
comes back around to the person, like us, who's doing the caregiving, whether some people lose their jobs, that they quit their jobs to have to do it, the extra cost, the extra burden, how do you manage that? The supplies that you have to buy to do it at home.
Yes.
Um, and then there's the emotional and mental tolls, which, need addressing. Yeah, it's just, calling it a savings is a very interesting. I mean, I'm sure that that's a insurance lobby, probably trade group or
I
something.
would imagine.
Yeah, yeah. But
Maybe savings
62
isn't the
million.
right word. I'm trying to remember exactly how they phrased it. It may have been
Yeah,
value, but either way,
yeah, yeah.
you know, it's a crappy term for what's happening.
It's a cost borne by the people who are least equipped to manage and handle that cost. And that's the
Absolutely.
issue that I think is at the core of this. So we're talking about
Hmm.
62 million people. I mean, that's what, roughly 20% of the country. I mean, this is a big issue. And that number is not, it's not like it's disproportionately one partisan group or another partisan group or one ethnic group of. I mean, that 62 million cuts across, socioeconomic boundaries. It cuts across, racial boundaries, religious boundaries, partisan boundaries. I mean, it's all encompassing.
Hmm.
And obviously in different categories, someone who's low income, they're going to deal with this in a massively different way than someone who's, upper
Right.
income, maybe the top 10%, of wealth. But there's still a cost borne, there's still a burden borne that I firmly believe shouldn't be borne, and then the
Yeah.
way it's doing, because we as a society should be taking care of, the most vulnerable. And to me, it's not even just the conversation about caring for elderly individuals, which tend to be a lot of them. Let's be
Mhm.
clear, it tends to be a lot of them. But again, there's also, you know disabled people at a young age, or even
Yep.
throughout any point in their life, who need care and fall into these categories. So it's not even like, well, you can write this off, because it's some people just say, oh, there's a bunch of old people, they're going to die anyway, they're close to the end, what matters.
Definitely not. There are
No, yeah,
families who have children with special needs who are born
yeah,
with special needs.
yeah,
And, there are very different support systems
yeah,
when they are in the pediatric category.
yeah.
And then when they transition to being an adult and in the adult care system, it falls apart because now they're in the
Yeah.
welcome to the jungle.
Yeah, different states, it's like, I've seen the 18 to 21 to 25 when they kind of age out of support services as an adult. But you look at a 25-year-old with Down syndrome, they still need support. They still need care. They still need all of that. And, there are many states that have great, support and caregiving systems for whether, again, whether it's a, intellectual disability or a developmental disability. There's many categories of needs. So there are a lot of states that do have great care systems. There's a lot of states that don't. And
Yep.
it's that patchwork that is the problem to
Yes.
it. I mean, it shouldn't, you should be getting the same level of care regardless of what zip code that you were born into,
Right.
or because you don't have a choice on that. You don't have a choice on who your parents are. You don't have a choice on what you're born with. But it shouldn't matter. It shouldn't matter how much money your family has. It shouldn't matter, again, where you're born. You should be able to access the care that you need. I mean, I talk about this when I talk about universal healthcare, but healthcare is a right. Health is a right.
Yeah.
And, I've had some people push back on me. Well, someone got into a great philosophical debate with me on that. And I ended up like kind of fizzling out because I was like, we're getting into some real deep pondering questions. But it was like, well, what is what is your determination that healthcare is a right? And I thought, because as a society, it's incumbent upon us as a society to care for everyone. And
Mm.
when you make the argument that a healthy person is entitled to care because they're healthy, but then they get sick or they get injured, but they're entitled to care. Well, the person who's born sick or injured should be able and entitled to that same care to become healthy. So, to me, it doesn't matter what your needs are or what you were born into. You have that access to it. And someone who's running for federal office, I view this as a federal problem. This is not a state problem. This is the national issue that we have to address. Because again, we fail young people, we fail people in the middle of their life, and we fail them at the end of their life. And we owe each group better than
Yeah.
they receive currently.
Yeah. I absolutely wholeheartedly agree. I think one of the things that people miss, people generally speaking, especially if you have not yet been a caregiver or received care, is that it doesn't affect one person. It is not the patient. It
Mhm.
is the patient and then this ripple effect of or network, however you want to visualize it, all of the people who are connected to them who are their support system. And it's not just support, quote unquote, that, oh, I'm going to drive you to your appointment. It is an entire network of
Mhm.
paid professionals, unpaid professionals, and it runs the whole gamut. And
Mhm.
depending on your social economic status, you have access to a much smaller little spider web than you do if you have many financial resources.
Yeah.
And it also affects generational wealth
Yes.
exponentially. And that is not something that has happened before. This is just now, I would
Mhm.
say in the last 15, 20 years, really starting to take root. And it is skyrocketing because the folks who are aging into needing care have not, for one reason or another, financially prepared for how much it is going to cost.
Yep.
So now their families, they all have a choice. Do we move them in with us? And so, I mean, there's a lifestyle cost there.
Mhm.
But if there's a financial limitation, which 98% of people, there is a financial limit,
Yes. Yeah.
um, what do? You start
Yeah.
dipping into your retirement. You start dipping into your savings, not theirs,
Mhm.
because theirs is already depleted.
Yeah. Yeah.
And it is
The
going to
economic,
be a generational effect for a long time.
Oh yeah, the economic impacts to this ripple, and I think in ways that I mean, like you hit on it. But you talk about like the person who has to drive them to an appointment, or the person who has to take off time because maybe they're, a little sick and so they need a little bit of extra care. I mean, that's lost wages. Not everyone is fortunate to work in a salaried position where, they get paid time off and they get paid even if they take the time off. A lot of people are maybe hourly,
Mhm.
or even there's even salaried people who still, if they take the time, they don't get paid time off, and so there's all factors there. So the lost wages component of that, and if it builds up, people again lose jobs. And but then again, there's this ongoing care cost. I mean, and when I posted about this, I got a number of people who pushed back and said, oh well, Medicare fully covers this. No, it does not. It does not.
Absolutely does not.
And people forget that, long-term care facilities that provide this are massively expensive. I mean, and I've seen, when I talked about this, I got so many people who chimed in sharing their stories, and people talking about spending 6,000, 7,000, 8, 9, 10, 11, and it kept going,
Per
depending on the
month,
level of per
not
month. Yeah, this is
annually.
per month. This is not, yeah, exactly. And that is, I don't have a mortgage payment anywhere near approaching that. But
Mhm.
again, so it becomes this like, but you're going to do it, and you're going to spend that. But where does that money come from? And for a
Right.
lot of people, if they put someone in a facility, and there's this great, not great, it's this debilitate. I call great as in it's big, but it's really
Mhm.
this massive like there's this guilt of I can't stomach the burden to care for them, so I need to put them in the facility because I can't provide
Yes.
what they need. So you struggle with this, and then you say, okay, I'm going to put them in this facility, and Medicare or insurance might cover X amount, then I'm going to pay the rest. Well, you don't get additional benefits like Medicaid to kick in until you've depleted everything.
Right.
And there's your generational wealth. You watch it
Yep.
just tick away slowly, slowly, slowly until there's nothing left. Oh, and then Medicaid will kick in and cover a different percentage of it. And it's like, why? And the flip side of that is, that someone's making a profit off of this.
Absolutely.
And it's not the caregivers who are caring for your loved one or you in that facility. It's the owners of those those businesses, which in many
Right.
cases are large corporations or private equity firms. It's the Wall Street. And you've got caregivers who are some cases making minimum wage caring for your loved ones and doing an exceptional job of it. But you're paying, what are you paying? You're paying all of this money for it just so some corporation can get, that. And it is, I've seen it called a wealth transfer, which is a very polite way to put theft. It's theft.
Absolutely. Yes.
It is a wealth transfer. It is eroding generational wealth, and it disproportionately impacts low income families because they don't have that massive pile of wealth to begin with. So
Mhm.
whatever they have, it disproportionately affects minority families as well.
Yeah.
And so that money is gone, and their loved ones still might need care. And then you have this whole next generation. So when the next person who comes along in that family needs care, the conversation becomes different. But yeah, I mean, a lot of people, I've seen even people who agree with the fundamental principle that we have to fix it. They're not calling it what it is, and it's theft. It's stealing money out of the pockets of American families who, are hardworking, who deserve to be able to leave a nest egg to the next generation, and it goes
Yeah.
away simply because someone needs care.
Yeah.
And that is the broken system, a massively broken system that we shouldn't have to accept.
Right.
We do. But it's a
It's all
system I
going
want
to
to
fall
change.
apart. And
Yes, and it will.
we're
Yeah.
watching it in real time
Mhm.
because right now people are selling their homes if they own one to pay for care.
Yeah.
We know now what the statistics are of people being able to afford homes.
Mhm.
They can't.
Yeah.
And so we are now seeing one of the biggest gaps in decades, maybe longer,
Mhm.
of people not owning a home.
Yeah.
And so, what are they going to do
Yeah.
to pay for care?
Yeah.
It's going to come to a head.
Yeah. Yeah. Oh, and I live in a district where I think it's about 40 something percent are renters to begin with. So you're
Yep.
I think it's I've seen different numbers and statistics that change. I think I've seen 41 and 46%, but that is a they don't have that invest, I struggle some days to call housing an investment anymore because I don't think it's been an investment since 2008 the way it used to once was.
Yeah,
But they don't even
I
have
agree.
that to turn back on.
Right.
So like I'm a lifelong renter. I don't the home that I'm in right now, I rent. I don't own. So if I was in a situation like that, I don't even have that to fall back on. And for my generation, and that's increasingly, an issue. Millennials, our home ownership rates are less than Gen X. They're
Mhm.
less than boomers. I look at my mom who lives in a house that is fully paid off. She doesn't have a mortgage. And so yeah, I mean, if she was in that situation, she could sell it. She lives in a stable, you know, uh location where she could
Mhm.
probably get a, you know, easily sell it. Um, but she's in a fortunate category. And even there's a lot
Yeah.
of boomers who don't have, or they live in areas where their house isn't going to fetch a high price because, and I have towns and cities in my district where that's, Cumberland, Maryland is a city in my district. It's a very historic city, but I'm gonna say it's right on a river and it's serviced by rail. And you probably can think where this is going next. The industry disappeared. It
Yeah.
collapsed. And Cumberland now is one of the poorest metropolitan statistical areas in the entire country.
Mm.
So the downtown Cumberland is gorgeous. I mean, if anyone ever comes to Western Maryland, go to Cumberland because it is.
I've been there. I can vouch.
You've been there.
It's
Okay, yes.
beautiful. Yes.
Beautiful. I mean, these structures, these buildings, but they are not going to fetch the price that they may have once fetched even 50 years ago. I mean, look at what these cost 50 years ago, inflation adjusted. It's not selling for the inflation adjusted number. It's selling
Mhm.
below it if you can even sell some of these places in a
Yeah.
city like Cumberland. And so that is, a city with an aging population where these needs are happening. There's nothing that isn't even calculus even going to be there. Or again, it is, but it's not. When you're talking about long-term care, that's $10,000 a month. You sell your house for, $100,000.
You don't even get a year.
You don't even, yeah, exactly. You don't even get a year, and that's assuming no other costs. That your 10 months, maybe 8 months, 7 months, 6 months, because a cost comes. Suddenly there's a hospitalization in there or something, and then you
Yeah.
lose the time. Yeah, it's incredibly, and it's pushing it onto people who, even someone like you and I who have experience
Mhm.
dealing with this, or like I spent 9 years working on the Affordable Care Act, and I spent time working on Medicare and Medicaid. I have experience and knowledge in the healthcare industry and understanding insurance and what's available. It's still hard for me to figure out. I still struggled trying to help my mom, make decisions and looking at this because she would turn to me and say, "Okay, you've worked with Medicare. What does this say?" And I'm like, "I don't know. Let me pick up the phone and call my friend who, is there." Or, the Aetna is saying this about long-term care insurance. What do they mean? And I'm like, let's sit down and read this and maybe we can figure it out together.
Right.
I'm in a fortunate category. You're in a fortunate category because of your experience. But we are the exception, not the rule.
Yes.
And the rule is that most people can't understand this. And so a lot of people, maybe they pay more than they should because they don't understand the benefits, and or they lose out on benefits entirely. that they didn't even
Right.
know that they were entitled for that could have helped, either provided better care or reduced the cost. And, you know, not a secret, but insurance companies and healthcare providers, they're not gonna tell you that stuff.
No, of course
They're
not.
not gonna help
And
you save money, you
that's
know?
probably the easiest fix, right?
Yeah.
There is no reason that there aren't a plethora
Yeah.
of experts that you can contact, almost like an insurance broker
Mhm.
who knows the plans inside and out and can say,
Yeah.
okay, this is what you need to do. This works for you. This fits in your financial category and
Mhm.
health wise where you are and where we think you might be going.
Yeah.
But that doesn't make the money for the people who are running the show.
No, no. I mean, like I said, I spent 9 years in the health insurance marketplace, and you have agents and brokers, and the certified application counselors and navigators. A lot of them are doing those are second jobs or third jobs because
Mhm.
it's not as lucrative, but it's a critical role to see. And that's just for getting insurance. In many instances, they're not there to necessarily help you understand, insurance. And the insurance companies themselves are not gonna, help you figure it out. But yeah, we don't have enough. That's why what you do is so impactful and so valuable to help people there. But you're just you're just one entity. And
Yeah.
I mean, this is, like I said, 62 million. You cannot help 62 million people. I know if you could, I'm sure you would, but you do not have the resources. I mean, no single person would, no business could help that many people,
Right.
and at all. And that's the problem. I mean, it's a healthcare problem, it's a caregiving problem, it's an institutional issue, and it really, I talk a lot about fixing structural defects. And
Mhm.
I just talk about the issue themselves. I don't want to slap, a label on them because sometimes the labels become partisan, but there's a lot of structural defects. And caregiving is a massive structural defect. And
Yeah.
it's only going to get worse. Like you said, 10,000 people a day, are turning, are hitting into their
65. Yeah.
65. That's a lot. That's a lot of people.
Uh-huh.
Um, and a lot of them, I don't know, what percentage of them probably, we're increasingly seeing have little to no retirement savings.
Hmm.
Which if they don't have retirement savings, they don't have a good long-term care plan. They probably don't have great insurance. They're going to be relying on Medicare and Social Security to provide for them to take care of them.
Hmm.
That's a risky proposition in and of itself, considering all of the concerns with Medicare and Social Security, which is a whole
Yes.
nother
Right.
conversation. But like this problem is only going to grow. I mean, 62 million is probably going to become 63 million of caregivers, then 64, then 65. And at what point do we say enough?
Yeah.
To me, we should have said it a long time ago. We should not be at 62 million having this conversation. But yeah,
53 million was the number 5 years ago. It's increased 10 million in 5 years. Yeah.
that's
It's an exponential problem.
yeah. Yeah. So I mean, in another 5 years, we could be at 75, 76 million, and it's just
Yeah. I mean, it's
eh,
it's directly tied to that six ages 65, 10,000 of
yeah,
them every day
yeah,
through, 2030, early 2030s. I
yeah,
mean, it's
yeah.
it's I don't love the term silver tsunami. People have been using that, but it
Yeah,
gives a good visual as
yeah,
to not just what's coming, but what's already happening.
yeah, yeah, yeah,
Yeah.
yeah. And like we talked about, there is a generational divide in wealth. And,
Yes.
so, um, the Gen X is not far, or that we're not far off from some of the oldest of Gen X to start to be approaching retirement and into
Mhm.
that category. And less of them are even equipped than boomers, and then millennials. I mean, again, our rates of home ownership, our rates of retirement
Yep.
savings are abysmal. I would love to sit here and say I'd bring my mom into my home to care, but again, I rent. My
Hmm.
ability to modify the space to care for her is non-existent. And that's not atypical. And,
Right.
so I think some of the problems are actually probably going to even accelerate
Yeah.
as we progress. And that's again the exponential curve, but the resources at our disposal, I mean, are are less, and that's not even to say like, other economic factors. Like for me to go out and buy a house now, it's the supply, it's just the cost of living, it's the interest rates to get it to take out a mortgage and all of those factors. But then to
Right.
find something that would work to care for someone, my supply is even more constrained, which is probably going to jack the price up even more. It's
Hmm.
probably not even affordable for me to even go out and find something. And it probably doesn't exist as a rental either. And
Yeah.
yeah, I like the term silver tsunami. I'd never heard that one before, but I mean, it's a bad term to describe it, but it's an interest. I've never heard of that term silver tsunami, but it's a great way to explain what's coming that I think people people are just ignoring.
Yeah.
Getting old is not fun, but people don't want to think about it, so we don't think about
Right.
these issues. Yeah.
Right. Well, and it's a very sensitive topic because people don't want to talk about how they didn't plan.
Yeah.
You don't want
Yeah.
to talk to your kids about what you coulda, woulda, shoulda done. It's
Yeah.
very hard to say, well, we missed the boat on this and this is
Yeah.
where we are. But the fact of the matter is the sooner you have that conversation
Yeah.
and everybody gets on the same page, then you can start making some decisions and make a plan so that when something does happen,
Mm.
you're not finding it all out in crisis mode
Yeah.
because that's
I
so much worse.
when my dad passed away, my parents had done, quite a bit of planning because of what, my dad's health issues.
Yes.
Um, but they hadn't fully planned out what to do if one of them had passed. I mean, there were some plans there, but it was not fully
Yeah.
planned out. And so, when they were dealing with this, and my parents live in Blacksburg, Virginia, which is a university town where Virginia Tech is. And
Mm.
I say that there is a great funeral home there. So if you are ever in Southwest Virginia, you know anyone there, McCoy Funeral Home, fantastic, tremendous. They took care of my dad, they took care of my grandfather, and they have an outstanding reputation, which
Yeah.
helped navigate that process for my mom.
Hmm.
But I say that is because not that doesn't exist everywhere, right? That
Right.
funeral homes, there are a lot of great funeral homes, there's also a lot of bad funeral homes.
Yeah.
Um, so that helped. But when we were making decisions, I told my mom, if there's a buy one, get one option on any of this, you need to think about that. And you need to
Hmm.
not say, I don't want to confront this because I think I've got, my grandmother passed away traumatically at 88. My grandfather lived into his early 90s. My mom's grandmother lived into her late 90s. My mom, she's in her mid 70s. She may still have 20 years left. But I
Hmm.
told her, you need to be ready because
Yeah.
we didn't expect my father to pass traumatically. Not that we had to scramble, but we did have to make a few
Yeah.
decisions faster than we had thought about it.
Right.
So we need to make these decisions now. And she was like, well, should I buy, like when she was buying a cemetery plot, we knew roughly, they knew wanted to be buried in town. Like some of it was kind of general,
Hmm.
but my mom, no, you're buying a double plot. We're not
Yeah.
going to buy a single plot and then we're going to revisit this conversation later. Is there space for you later? Is there not? No, we're going to buy a double plot.
Yeah.
She was in a financial position to be able to afford to do it. And I said, you're going to do it. And she was like, well, but I don't like the idea. And I'm like, you are going to save me,
Hmm.
and the rest of the family from a decision later because it's
Right.
bought, it's paid for. And when you pass away, you just got to dig the hole and, crudely dig the
Yeah.
hole and plop you in, and we're good. Like there's no cost there, So she prepaid for the plot. She prepaid for, the headstone and things. I
Mhm.
say she hates the fact. she didn't. My mom didn't change her name when she got married. She kept her last name.
Hmm.
So my parents had two different last names, and I always had to explain that growing up. But when they made this like a bench, and then there's little plaques on the ground. When they made the bench, they put both
Yeah.
names on it. My mom hates that because she says every time she goes to visit my dad, it reminds her of
Yeah.
her own mortality.
Right.
But it's kind of, I told her,
That's
like,
hard.
it's hard. I get it. It's hard. I wouldn't want to see it. It's hard seeing Wechtaluk on a gravestone, because I was like at
Yes.
that. I'm like, oh God, mine's going to be mine going to be like that one day. But you saved us from a decision later. Do you want it?
Right.
Was who comes first? Is it hyphenated? Is it a slash? Do we do it in different? Like, we made those
Yeah.
decisions now,
Yeah.
so having her prepay for things, having her plan those things out was at the time, you don't didn't it was a tough conversation. My dad has just passed. We're having to deal with these things. I don't want to think about losing my mom. She
Hmm.
obviously didn't want to think about dying either, but I knew that whether it's tomorrow or 5 years or 10 years or 15 years or whatever from now,
Yeah.
we'll be grateful we made that decision.
Right. Well, and
It's
it's
important.
for couples who want to be buried together,
Mhm.
you kind of have to do it that way
Yeah.
because
Yeah.
there's no guarantee that you're going to be buried together
Hmm. Yeah.
if you don't.
Yeah.
So,
Yeah.
yeah, I mean, we did the same with my parents when my mom passed.
Yeah.
It's like, well, they want to be buried together. So my dad's name is on the stone. It just doesn't have
Yeah.
the other
Gonna
year
break.
on it yet.
Yeah. Yeah. Yeah.
Knock wood. Sorry, Dad.
Well, that was the compromise I actually was struck with my mom, is that they wouldn't put, because they said, well, we can put the other plaque in the ground and do that. She drew the line at that. I said, okay, fine. I
Yeah.
will respect that, but we're still gonna pay. It still needs to be paid for now, so that
Right. Because it's only
all
going
they
to
have
get
to
more
do is
expensive.
exactly, yeah. So let's put it in now. But I did not push her to put her plaque with the birth date in an empty space. I was like, okay, I won't push on that one.
Yeah.
I get it. I understand. Um, yeah, and both my grandparents were buried. They're buried in national cemeteries. I've
Mhm.
my mom's parents are buried in Arlington National Cemetery. And then my grandmother, my paternal grandmother, she's 96. She's still kicking. But her husband, my grandfather, is buried in a national cemetery in New York. So, and that's the same kind of, they prepare for to have both people there. So that
Mhm.
kind of took a little bit of a burden, off of that. But
Yeah.
that introduces a whole other aspect of caring for veterans and navigating a veteran process when you have military families and military communities and things like that. That adds
Yes.
another dynamic and wrinkle to it, which was when we navigated. A lot of the national cemeteries are great. There's some mismanagement there, could be better, but they were such care, and but
Yeah.
there's a lot to it. And especially here in Arlington, it takes a couple months from when someone passes to get buried, and that's a weird thing to think about.
Yeah.
Navigating that process, but planning it was different, and the whole just not just dealing with it was just a fundamentally different, process. But again, it's having those conversations.
Mhm.
And so, when I went through it with my dad, it prompted my wife and I to think about things. We need to think
Yep.
about this ourselves. You're 6 months pregnant. We already have kids. What, you know, we had life insurance policies, and I had a long term disability policy through work, and I feel like, okay, I'm doing enough. Am I doing enough? Is that even, probably more than most, but you know, what else do we need to do, and what conversations do we need to have? And
Mhm.
um, do you want to be, does it even, it's just care, like if you're if you're in a vegetative state, what do you want? And
Yes.
you, when you're in your 30s, that's not a conversation you want to have.
No,
But
it's not. But the
yeah,
reality is, as soon as somebody turns 18, parents aren't allowed to make decisions. Families
yeah,
not allowed to make decisions anymore.
yeah, yeah.
So for those of you who are listening, I think it's probably been a little bit since I've reminded them. There is a document, it's free of charge. You can download it from the internet. How old am I that I just called it the internet? Whatever. Um, as the words left my mouth, I was like,
Yeah.
oh, Gen X for the win. Um, it's called Five Wishes, and it's a legally binding document, but it's free. All
Mm,
you have to do is get two witnesses who are not related to you to sign it
mm,
and get it notarized. So there's a very minimal fee, however
yeah.
much you have to pay for a notary. But it prompts you, do you want this? I do not want this, whatever. And you just check boxes. And if you want to
Mm,
write in specific things, you can.
yeah.
I did it. It took me maybe 15 minutes to fill out. It is
Yeah.
not long. And
Yeah.
I actually got the copy from my primary care physician. They had them
Oh,
in the exam rooms.
yeah.
But if your doctor doesn't have it, you can get it
Yeah.
offline
Yeah. Oh,
for
that's
free.
great. I mean, it streamlines the process. I wish I had known about that. Would have been, but yeah, I mean, that's a great resource. I'm gonna make sure to let more people know about that because yeah, there's so much to think about, and
Yeah.
and even when my wife and I were very thankfully when we started having these conversations, we were on the same page. I think the only thing that we differ on is, when we do finally die, where we want to be buried. But the caregiving aspects and, all of that, we were on the same page on. But we didn't know that till we had that conversation. And it's better to
Yeah.
have that conversation before you get there versus when someone's lying in the hospital and they're, paralyzed, or they've got whatever injury that's going to require ongoing treatment, or or again they're in a coma or whatever. Like, then you have to make decisions. And that's when caregiving is already tough, but when you're
Yes.
thrust into an emergency situation with no thought, no planning, no preparation, it's
Hmm.
exponentially harder to navigate that. And that's where that preparation, having those conversations now,
Yeah.
um, it's not something that can like legally mandate people to think about that. But why can't it be, we, because I think to our education system, that should be something, they talk about home ec classes and preparing people. Why not talk about this in home ec? Why not have a I don't know what you want to call it, a society preparation class, right? In high
Yeah.
schools to talk about, they used to be balancing a checkbook. As checkbooks are kind of falling out, these days.
Yeah.
But, like skills like that. But one of them is filling out a document like that,
Hmm.
to make it known.
Yeah.
There's, I think, so many solutions. I mean, heck, my driver's license lets them know if I want them to donate my organs. Why can't my driver's license also note that I don't want to be resuscitated, or that I do want to be resuscitated, or
Hmm.
like, why? Technology is great. They pull up my
Yeah.
driver's license and scan the code, and boom, it pops up. These are my wishes.
Right.
These are, they already know
Yeah.
who to contact. It's got a point of contact associated with it. Why not include that information with your driver's license? So if you're in an accident or something,
Yeah.
that information. Like, there's so many, I think, ways to think about this, but we need to be starting young. We need to be, like you're
Mhm.
saying, 18, you are on your own to make these decisions. And not many 18-year-olds are equipped to make a decision like that, because they've never, some of them are. I was one of the ones who had to think about that because I had this, kind of thrust onto me at a young age.
Yeah.
But even though I know there's more people like me than I probably realized, it's still a minority of people that are not aware of what needs to happen.
Right. Yeah.
Yeah,
Um, I want to make sure that we talk about the VA,
yeah,
and anything that you want to say around that, because I know you are familiar with how that works
yeah,
because you've had service members in your family and because of your
mm,
professional
yeah.
experience. So, yeah, let's chat about that for a bit.
Yeah, yeah. Both my grandfathers were served in the military. One of my maternal grandfather was a career Marine. I say 30 years. I think he retired like 2 months short of 30 years or something like that.
Mhm.
So full service. My other grandfather served in World War II, and came home. But my maternal grandfather was also wounded in action. He received two Purple Hearts, which set him up for a lifetime of needing, potential additional care.
Yeah.
Um, so as I was a kid and growing up with my grandparents, and experiencing that, I got to see how the VA didn't work. I won't mince words on this conversation because I think, as someone who saw it firsthand and growing up with service members, it's important for a lot of other families that as running for Congress that I am very clear the VA fails our servicemen and women. It fails them completely. The system is burdened, whether it's just getting basic benefits or again, the National Cemetery Administration, which is part of the VA in terms of burying our service members, whether they come home in a dignified transfer, which I know is something that you understand, or they, die here stateside from injuries, or much later in life because of,
Yeah.
like there's so much to, that, whether they're entitled to benefits just because of their service, or they're entitled to benefits because they were exposed to Agent Orange or burn pits,
Hmm.
or again they just need care. They go to a local VA medical center, to get their care, because whether it's to see their primary care or to any other additional measures of care, whether it's to treat a condition that's related to their service or not related to the service. The VA does so much,
Hmm.
and it does so much poorly. And I spent 2 years working at the VA as a contractor, and this is not an insult to a lot of the people who work at the VA, because there are amazing people who work at the VA. There are amazing people who work at a lot of federal agencies who are given a task that they're not equipped to handle and funded to handle. And it's not a knock on their professional capabilities. It's just a knock on the system is not set up to work. And the VA is, there's so many congressional mandates and things and how they have to operate and what they have to do and what the funding is to do certain things that fall short of what needs to happen.
Hmm.
And so you see, again, whether it's we have the greatest generation is for the most part died off. There's still,
Yeah.
some of them that are left. But so people, a lot of people sit there and think, oh, well, this is just once the last of the greatest generation dies off, we'll be fine. No, I'm here to tell you, absolutely not. You have Korean War veterans, you have Vietnam War veterans, you have Gulf War veterans, you have Iraq and Afghani War veterans. Now you're going to have a war in Iran veterans,
Mhm.
and then there's every other conflict, small conflict. They were this. You don't have to be in a war to be injured to need medical care,
Right.
or to have experienced something. There are plenty of ways that people can be in conflict that's not an actual conflict and still need care and treatment.
Or
And
even just a simple training accident.
exact. Oh, that
Shouldn't call
yes,
it a
training accident.
simple, but yeah, I mean, it doesn't even have to be
Yeah,
aggressive. It can
there was an
happen just,
that air show the other day where the two planes
yes,
collided. Yes,
yes.
one of those they ejected. Thankfully, all four ejected. One of them slams down to the ground and ejected, or experiences an issue in because ejections are violent.
Hmm.
Yeah, so exactly. It can be something benign.
Yeah.
But we have a duty when we have these, men and women enlist to serve our country. We have a duty to take care of them.
Yes.
because they are volunteering to put themselves to protect us. We have a duty to take care of them when their service is up.
Hmm.
And um and that's where the VA just comes short. And I spent 2 years working to on the electronic health record system, because
Hmm.
VA has this old system that they're trying to replace with a new system that's going to be interfacing with the DoD's system. It, it's a massive rollout. The costs are skyrocketing. I'm not even going to touch that it's being implemented by Oracle. That's a whole separate conversation about the vendor
You said
selection.
enough just with that one sentence.
Yeah,
Anybody
people
who knows
can.
anything about Oracle got it.
Yeah, exactly. So, um, but I saw a lot in that
Hmm.
time, and we have to fix the system at the
Yeah.
VA. Some of that is straight up funding. It's just they are underfunded. They have been underfunded, um, and they need funding. There are programs that it's not that they are inefficient. It's not that they are wasteful. It's not that they are over budget. They are spectacular programs run by great administrators and great, bureaucrats and professional staff. They just have been doing it with a shoestring budget, and veterans pay the price. Give those
Yeah.
people the money that they need to service their veterans appropriately.
Right.
There are programs that are over budget, that are full of fraud, that are full of waste, that need to be fixed. Let's fix those programs, and let's have an honest, truthful conversation about what it's going to take to fix those programs. That's not happening. People think it is, it's not happening.
Hmm.
Um, and then there are other things where it's just a case of it needs the proper investment to do what it's do needs to do.
Hmm.
It needs work. It's not like it's working, but just needs money to scale. They're not working. Benefits payments are behind. They don't get them when they're supposed to. And in many instances, those benefit systems are broken, they're old, they need to be upgraded or, replaced entirely. And so that takes money, that takes careful oversight to ensure that that money is spent properly. And so we need to invest in that. All of that will help us care for this population better.
Right.
And and it's just, as we approach Memorial Day, and I know Memorial Day is to honor those who made the ultimate sacrifice, and Veterans Day is in the fall. But there are so many people. When we think about Memorial Day, we honor those who made that sacrifice. But there's plenty of people who made a sacrifice who are still here. And
Hmm.
for me, we failed them. And I watched my grandfathers navigate a system with their benefits and their care that I thought, God, this is bad. And especially for my paternal grandfather who passed away when I was a teenager, I didn't fully understand. I mean, I knew some of it,
Yeah.
but then, my maternal grandfather, when I was in my early 30s, I my, my eyes were already wide open to the issues,
Hmm.
and I was helping him try to navigate some of this and deal with it to make sure that he was getting what he was supposed to be getting, and it just, again, I had an advantage because I understood things. It was
Yeah.
still difficult for me, but it should not. Veteran care should not be difficult. I mean, it should not be
No.
difficult. They have, we have, I've heard a lot of stories that have traumatized me to hear how, and I was talking to one family, and they were dealing with the parent who was a Vietnam veteran and was exposed to Agent Orange and is dealing with a whole host of health issues and complications, and as a result of it, and they are fighting, fighting to get care because their records, there was a big, I think people, there was a big fire at a records facility, and was it
Yes.
Kansas City or
Kansas.
was it
Uh-huh.
St. Louis or something, somewhere,
Yeah.
and a lot of records were lost.
Hmm.
Um, and so records of their service were missing and trying to find records of the service to ensure that they're entitled to get benefits. And it's like the caregivers at the VA hospital are not disputing they are a veteran. They have, their paperwork, but because it can't be validated and against the government's paperwork, the benefits are getting held up. And here you have a veteran who served in Vietnam, was exposed to something horrible, who deserves care, and they're not getting the care. The family's bearing the cost because of administrative failures.
Right.
That that's not a unique story either. That's a very
No.
common story.
Yep.
Um, and so like there's a whole, as I said, when you talk about caregiving for veterans, it's a whole separate conversation because you're navigating this bureaucracy
Hmm.
that should be paying, but it's not paying. And that's, that is one of my biggest priorities because again, I've seen it personally and I've seen it professionally.
Hmm.
And then I hear the stories and we have to do better. I have a very war averse position. I think we spend too much money on armed conflict, and I would love to see, our defense budget shrink. Um, and a lot of that is due to many reasons, but one of them is if we cannot take care of the people that we expect to serve in those roles, we should
Yes.
not be hiring more people to serve in those roles.
Hmm.
And we can't take care of them. We
Yeah.
we we just simply we can, but we're not. So that's why I say we can't. We should.
Right.
It's just it's a bureaucratic failure, and it's not a partisan failure either. It is a bipartisan bureaucratic failure. Both administrations, both parties have had administrations who had opportunities to make changes. Um, you know, recent like the Burn Pact Act, which addresses burn pits
Yep.
for Iraq and Afghanistan. Again, this is 21st century conflict. We don't even go back. The
Hmm.
Pact Act was passed, and I was at the VA when some of it was starting to take an impact. It was underfunded out of the gate. It was underfunded. You have an agency that's already underfunded and understaffed, and then you put new legislation putting new burdens on them, which is going to require more funding and more staff that they already don't have. So now the funding deficit grows, the staffing deficit grows. Um, and, COVID highlighted a massive issue with medical staffing.
Hmm.
And you found a lot of people, especially nurses, who found that their worth was not valued. They knew it
Hmm.
already, but then they realized there was ways to go seek out more value. And I'm not going to shame any nurse who went and got paid for their work, right? They deserve it.
Yeah.
But the VA does not compensate medical professionals at the same rates that they could get in, a non-government facility.
Right.
So it takes a special kind of person to be a VA doctor or a VA
Hmm.
nurse or any VA provider. Whether it's from a medical technician to the person who's running the autoclave to clean the equipment. I mean, they're
Yeah.
making less than they would make at another facility. Um, and they're doing it with facilities that are underfunded, that are outdated,
Hmm.
with electronic health record systems that in many cases are 20 years old, that don't talk, that don't interface. Um, it's bad. I don't think people
Yeah.
realize how bad it really gets for veterans. And as bad as it is outside of that, it's awful. And it's something that I want to see fixed, and it's something I'm going to push for to get
Yeah.
fixed. And yeah.
Yeah. The dichotomy is striking that we spend top dollar for the aggressive side of
Mhm.
the Department of Defense budget.
Yeah.
And we don't spend top dollar. We go to lowest bidder
Yeah.
for the care of the
Yes.
people who have
Mhm.
served the country.
Yeah.
It's backwards.
Yeah. And the one thing that I think people realize is the DoD and VA are two separate agencies
Yeah.
entirely. They are they are not linked at the hip. They are two entirely separate agencies with entirely separate structures. And I'm not saying the DoD is a great administratively run agency because it's not. Its current Secretary of Defense, notwithstanding, not even it's not even just him. It's a long history of the DoD being administratively issues. When I went to the VA, even knowing what I knew about the system and everything, I still expected that the VA, in some semblance, would have, because it's military adjacent in that regard. I would have expected something, and I was
Yeah.
very taken aback. It's not. It's not at all. There's no military rigor. There's no military structure, for but better or worse, right? It's just not
Mhm.
existent. Um, yeah, I mean, we spend billions of dollars fighting wars, billions of dollars on programs to build new fighter jets, and I saw an analysis. I saw a video of an anti-aircraft gun kind of shooting down a drone, and the point was is that each round was like $1 million flying up, and in this clip you see it shoot like 60 rounds in a matter of seconds, and like 60
Yeah.
million dollars going up in the air to shoot down a $20,000 drone. That's $60 million that is could go a long way to caring for veterans, and we're
Absolutely.
spending it on, yeah. So if we can pass it's not going to pass, but if they're going to propose a $1.5 trillion defense budget, when we should have a $1.5 trillion budget at the VA,
Absolutely.
let's
Yes. What's good
it's
for the goose should be good for the gander.
exactly. It's very disappointing,
Yeah.
to see it. And
Because you
eh,
can't claim that we support our troops if you don't support them throughout the entirety of their life.
yeah, veteran
Otherwise, you're just
homelessness.
supporting conflict.
Yeah, you're supporting war. I mean, that's exactly. You become, people hate the term warmonger, but you become a warmonger if you don't care for them when the war is over. Yeah, I mean,
Yep.
veteran homelessness is a big issue. Veteran
Yes.
suicide, I think I saw at one point, and I don't want anyone to quote me on this in case it was wrong, but I think I saw like veteran commit suicide like every 18 seconds or something like that. I mean, the
It's
numbers
an
are,
astronomical number.
yeah,
Yes.
the PTSD components. I mean, mental health care is a massive issue for veterans.
Yes.
Um, but then, you talk about, assistance programs, to help veterans to transition, which are an essential of a caregiving program. These are people who have experienced conflict, even the ones who come back. Let me make this clear. No one comes back from an armed conflict unharmed. That is a
Right.
myth.
Yep.
That is a myth that is packaged and sold. Everyone comes back from an armed conflict with at best mental scars from what you've
Yes.
borne and what you've seen and what you've witnessed. So everyone comes back harmed. They all need care. And that's, transitioning to civilian life, because a lot of, the service members, they enlist at 18, fresh out of high school, and they've never held an actual job. They've never bought a house. They may never have done a lot of these services. And then again, they're coming back with mental wounds or physical wounds, and they need care. So they need assistance, transitioning into civilian life and finding a home and finding therapy, and all of those things. I mean, that is it's a different kind of caregiving than some of what we've talked about, but
Yes.
because they've served us, we need to provide that care back to them. And those programs again are underfunded. And in many instances, we have veterans who come home who may not even be aware that these programs exist.
Hmm.
If they don't return, to a major base, if that's not a major base, not their home base, they may not be even aware of that. So
Hmm.
they fall through the cracks. And that's when we lose veterans to, again, they end up homeless, they end up, suicidal. And that is that is the that is not a they problem. That's not that's an us problem. That is a societal issue that we
Hmm.
have to address, to care for them. I mean, that goes like these expression cradle to grave. I don't know if there's equivalent expression here of, that, but I mean, it kind of when they return home, that's like, that moment, we are responsible for them as a society for their care. From
Yes.
from that moment until they die, we are societally responsible to be caregivers to them. And if we don't, as a society, want to accept that, then we need to stop sending people into conflict. We need to stop funding these massive defense budgets. So you can't have both.
Right.
And yeah, it's it's a tough, and becomes a very emotional issue because you're dealing
Hmm.
with I remember my grandfather, when I was a fifth grade, sixth grade, I did a report about the Korean War because my grandfather had served in the Korean War, which I was in Reservoir. That's where he was wounded,
Hmm.
and received an award for bravery in there. So I was very proud of him as a young kid, and I wrote a report about it. And when I wrote the report about it, this would have been late 90s, so 45, almost 50 years later. I interviewed him and he told me some stories and things about that. So I wrote my report and I had my mom read it. She read the report and then she paused when she got to the end and she said, I never knew this. He never talked about it.
Yep.
And it turns out this was the first time my grandfather had opened up about some of these stories. Almost 50 years later, he had kept these to himself.
That is so
And
much to carry.
yeah, this is what our veterans carry with them.
Yeah.
50 years it took my grandfather to open up and tell a story about his experiences in war. It's just that this so when people are sitting there saying, oh well, you might be dramatizing, it's a societal burden. I'm not dramatizing it. Pick up the phone. If you know someone who's served in the military, pick up the phone and call them and talk to them and ask them, what it was like or what they
Yeah.
experienced, because they may have never talked about it before and maybe they want to talk about it, maybe they don't know how to bring it up, but
Hmm.
it is a lot of them suffer in silence. They don't know
Yes.
what to say and they don't know who to talk to and they may not have access to therapy. So it's as simple, honestly, as just picking up the phone and saying, or going to their house, drive to their house, meet them in person, go out for a beer, go out for a coffee, go out for,
Mhm.
buy them lunch and say, hey, you want
Yeah.
to talk? But because um, that is that's caregiving right there.
Yes.
Yeah, that's caregiving. That's being there for them, and it's critically important. So no one should have to wait 50 years to talk about their experience. And that it's not me saying we didn't love my grandfather. He was well loved and well, very well. But it was just the moment in which he decided that now's the time to talk about it. But no one should have to carry that with them if they don't want to. And a lot of them don't want to. My grandfather made a choice, which
Right.
was he was okay with, but too many are making a choice that they're not okay with. And that's when they end up on the street, or that's when they find their solution at the bottom of a bottle of pills. It's not okay. I
No.
hate that. I hate that. So yeah, it's something that I want to fix because and I know that's a simple where I want to fix it, right? This is a big I'm talking about this big issue and then well I'm gonna fix it. But it's just something that, piece by piece it has to be addressed. It's something that is like I said, critically important to me. And especially, when I first started running for Congress, we were not in the midst of a not war with Iran, a war
Hmm.
that's not a war. As you asked the Trump administration, it's not a war. We are now. So again, now we're exposing a whole new generation to this. Gen Z is now getting to it, and so we've got the greatest generation and the boomers and Gen X, the millennials who we've all experienced this, and now Gen Z is experiencing this, and we are still
Yeah.
unequipped to take
Yes.
care of them.
The thing in addition to everything you said, that
Yeah.
I want people to take away from this conversation
Mhm.
is it does need to be fixed, but it cannot be fixed in one fell swoop.
Yeah.
People need patience and they
Mhm.
need to recognize slow and steady progress.
Yeah.
And folks in office need to do a good job of making people aware of that
Mhm.
slow and steady progress so that it can
Yeah.
continue and
Yeah.
eventually get to the point where it's fixed.
Yeah.
Because we can
Yeah.
throw a whole lot of money at it, but it still needs to be implemented. There still need to be
Yeah.
plans. So
Yes.
we just
Yeah.
need an educated public
Yeah.
as
I
well.
oh, okay. I'm so glad that you said that. I had someone ask me question of like, okay, you have these bold ideas, how are you going to implement them? Because there's a lot of words, and none of these are going to be easy. And one of the things that I've talked about is, and maybe this is the consultant in me, is an iterative approach.
Yeah.
And so what I
Yes.
mean by that is so much of legislation is these massive bills that, we're going to put this big bill to structurally reform the VA, and it's 700 pages and it's dense and all of this, and then it fails, and then nothing happens.
Yeah. Because it's too much.
Let's too much, right? And everyone's got the bone to pick, this bill or that bill. Like, and then you get the riders and things that are added on. Like, here's an example. There's a housing bill that just passed. There is a rider on the housing bill that is going to stop the creation of a digital currency until 2030. Has nothing to do with housing. It's just added in there just because. So this, like, that whole thing, like, it's just, that's my example because it's a timely one. So go look at bills that
Yes.
get passed and see what little things are stuck in there that have nothing to do with the rest of the bill.
Yeah.
What I mean by an iterative approach is rather than one giant bill that's going to try to fix every issue with the VA all at once, let's go
Mhm.
piece by piece. Let's
Yes.
look at, because like VA is broken down. There's the VBA, which is Veteran Benefits Administration. There's the VHA, Veterans Hospital or Health Administration. There's the National Cemetery Administration. And even then, there's divisions and things underneath them. So
Yes.
let's look at one structural problem at a time and
Hmm.
address those structural problems with a piece of legislation. So
Yeah.
if we're addressing, let's talk about cemeteries and the National Cemetery Administration and the backlog of burials at cemeteries and the administrative issues that have dealt with poor management systems and underfunding of the management systems so that they lose sight of where people should be and all of this. Some of
Hmm.
that is being improved, but let's have one bill that addresses those issues. We
Yes.
pass it, we sign it, because that's not going to be a controversial topic. No one's
Hmm.
going to sit there and say taking care of our national cemeteries is going to be an issue. That's a bipartisan. That's not going to be debated and contested. Maybe some merits of things like that, but those can be worked on because we're just talking about a single issue. Let's
Hmm.
pass that. Then let's move on. Let's move to the next issue. Let's deal
Yes.
with, again, funding for benefits for the PACT Act, which just, recently passed. But let's structurally take a look at that. Let's fix that, So let's break
Hmm.
these down. And so that's what I mean by, like I said, an iterative approach of these massive bills. Congress has to stop this
Yes.
because these omnibus bills, that get into thousands of pages, several thousands of pages, some of them do. No one understands them. No one, truly gets them. They become so contentious and so ugly. I would, and this is not me. Someone said, well, you're just trying to pump up your numbers to make you look good about how much legislation you get passed or introduced. And I said, no, I don't care about that. I don't care.
Mhm.
That's not what I'm trying to do. I'm trying to get issues addressed. And the iterative approach is going to be the best way because, you have to build coalitions around an issue. And, if I'll use a controversial topic of gun control.
Mhm.
There are some elements of gun control that are controversial. There are
Yeah.
some elements of gun control that are 90% consensus among the general public, universal background checks. So why would I pass a comprehensive bill that's going to have a controversial element in it that might be a 50-50 issue that's going to tank a 90-10 issue? No, that makes no
Right.
sense. So let's
Exactly.
pull the 90-10 issue out, get that passed. Maybe the 80-20 issue gets passed, the 70-30 issue gets passed. And then when we get
Mhm.
to the 50-50 and the 60-40 issues, we can address those and figure out how we can take it from 50-50 to 51-49, and then boom, it passes, right?
Yeah.
And so like that is how I am viewing a lot of this. And it's attainable. It's just not not enough people in Congress have tried it. Congress needs structural change too. Let's be honest. I don't think anyone's going to dispute that. But
Right.
so when we do that and we take these different approaches to passing legislation, we'll get those things done. But like you said, it's going to take time. It's
Yeah.
not going to happen overnight. I joke about my day one promises. I have like 100, maybe now it's up to 150 hours of day one promises. There's only 24 hours in a day. So maybe
Hmm.
I need to, I joke my first bill is going to change the length of day one for me so I can try to get it all done. Um, but like, yeah, being real with people. I mean, these are not day one. These are not first 100 days. These may be a year two issue. These may be issues that I'm just going to have to fight and scrap for an entire 2 years and then ask you, can you reelect me so I can continue to fight? Because
Right.
I, because maybe I got three bills passed on an issue, but I still have three more to go,
Mm.
And so I want to show progress. I want to show people that government can work and can get it done. But yeah, it takes time. And
Yeah.
even before this administration, there was a lot to do after. I mean, I would come in halfway through this administration. There's not just fixing the issues that exist, there's also going to be repairing some damage as well. So
Yeah.
yeah, people are going to have to be patient because there's a lot to get done. But um, I tell people I don't quit. Maybe I should. I should not fight every issue. My wife tells me this. You need to learn to quit on some things. But I don't. I'm incredibly stubborn. That is a great attribute for me. And especially if I get started on it, if I get that first bill passed, oh God, I will see it through. I'm not gonna
Yeah.
stop because I got something done and it's partially done and it's gonna bother me until it's finished. And it'll eat away at me, and I'm gonna keep working at it. So
Yeah.
yeah, and the same goes to just we talking about VA, but even going back to regular caregiving, and there's a number of legislative things that we've talked about that would need changes. And whether it's, I believe in universal healthcare, Medicare for all, which is going to solve some problems, but, we need to have structural reforms to long term care. And we
Yeah.
need to find ways to increase pay for caregivers. And again, whether those are caregiver, maybe we look at programs for if someone is caregiving in a home, there is some sort of government assistance program to support caregivers and like again, those programs need to be talked about. They need to be, investigated. They need to be debated and, the funding sources and I'm committed to having those conversations to do it. But yeah, we're not going to solve caregiving either with one bill,
Right.
but it's going to take time. And that's why I tell everyone like I go into this with wide eyes. I'm not naive. People would say, "Well, you're young, you don't understand it." Maybe I don't understand everything, right? But I'm not naive. I've been involved. My first taste of politics, I was about probably 4 or 5 years old. Yeah, I hardly understood a thing at that time, but I've done a lot since then, and I know what I'm getting myself into, and I'm not naive. I just refuse to accept the status quo is working for anyone because it's not. You
Yes.
know, it's failing us. It's failing our veterans, it's failing our caregivers, it's failing our elderly, it's failing our disabled, it's failing us in so many ways. And you know, and then you don't even like then there's things that we didn't even bring into this conversation, like how climate change exacerbates health conditions
Yes.
for all of these vulnerable populations that we've spent all this time discussing. Then you have climate change, which is going to make some of that even worse.
Yeah.
Like, I just refuse to accept that this is how it has to be. As someone who's experienced caregiving firsthand and
Hmm.
how it was and the toll it took on me, the mental, the personal, the emotional, and then the toll it took on the loved ones that I was caring for.
Hmm.
Um, it doesn't have to be like this. It
Right.
doesn't. Um, and yeah, I like fighting injustices. I like trying to right the wrongs, but I believe that we can do better as a society. Other
Yeah.
countries do better. And
Mhm.
and there is your people say, oh well, it's not possible. And I was like, well, if it's not possible, then how come other places can do it? How come other countries and their systems aren't perfect either, but at least they have a system that exists.
Right.
So
Their
let's
people aren't going bankrupt trying to get treatment.
yeah, you don't see too many Scandinavian families worried about bankruptcy for long-term care or
Right.
basic, support. You don't really see that as a structural issue in society in Sweden or Norway or Denmark or even Central Europe. They don't have the
Yeah.
same, issues, and some of those countries have populations that are aging faster than ours.
Right.
Japan is the country that has a very, very, the gap is quite large. They
Yes.
don't have, some of the same issues in Japan, but they also revere their elderly. So,
That's
it's
different too.
that's different. That's a whole different, and that's a whole different, societal belief structure.
Hmm.
But yeah, I just refuse to accept the status quo. And
Yeah.
that's why I started running. And when I waited in this issue and you found me, I thought I said, surely I'm gonna have company here, legislatively, politically, and I am on an island. And I think the first thing I do is I'm going to send out a lot of ships. I'm going to bring a whole hell of a lot of people to my island, and I'm going to make them understand this problem. I'm going to build that coalition to sit there and say, if you haven't experienced this, you will. You will.
Yes.
And maybe you have already experienced this and you've forgotten what it was like. And
Hmm.
you need to be reminded of what it's like, and then reminded you have the power to make sure that this doesn't happen to you again or to happen to someone else.
Right.
And have those conversations and push the issue. And like I said, it's not week one, it's not going to be week two, but we'll get there. I know there are other people who feel this way. This is just, one of those. I mean, you know this. I'm preaching to the choir with you and your listeners. This is a topic that people don't talk about. They just keep
Right.
bottled up inside them. And let's talk about it more. Let's push this conversation to the front of
Yes.
we need to be talking about caregiving just as much as we're talking about, how expensive healthcare bills are.
Right.
We should. They're hand in hand. They're the same
Yes, they are.
conversation. So let's have them both at the same time.
Yeah.
So I'm like, that's why I'm excited we got to talk about all of this today because it's
Me
so
too.
critically important. Yeah.
Absolutely. I really appreciate your time
Oh yeah, of course.
and the fact that you are taking everything that you have learned and you have experienced and lived through and applying it to making it better for other people. Um, a lot of what we see in government right now is short term. Everything is very short sighted. And we are not looking long term. We are not focusing on not just making things better, 10 years from now, but for the generations who are coming up behind
Yeah.
us.
Yep.
And so I very much appreciate your approach and the way that you are looking at and thinking about things because it is what we need as a country for the next 250 years.
Exactly. Yeah.
Yeah. Well, thank you so much for joining us
Yeah.
today. And for those of you at home, in the car, at home, like I said, or wherever you are, we will see you right back here next time. Until then, take care.